So this is the MacArthur, and you'll see very large effects here, and this is the CSBS, similar effects. So the parents thought that their children were doing hugely better after the treatment. We also did a number of post-treatment interviews to look at how they evaluated what had gone on. And obviously these are anecdotal, so these have just taken, but this is fairly representative of what a lot of the parents said. They were very enthusiastic about the treatment they received. It took a while, but about halfway through, three-quarters of the way through, he became a different little person. He'd sit there for longer playing, he'd want me involved, and he was good at he wasn't getting frustrated because I was making him wait too long. I managed to get my timing right, and that was the sort of thing that we were trying to enhance. When he reached out, I'd just be onto it. It was a revelation to me. I thought I was the only person who knew my child, and I didn't. When I watched the video, he had his back to me. He wasn't playing with me at all. Now I know him best, but I didn't at the start of the treatment. So, just to summarize our results, this is what we got in this pre-specified pattern of analysis. And we really pre-specified it in order to look at the, as it were, transmission chain from parent change to child outcome. And you'll see that we get quite a clear picture, which is here's the treatment. The treatment has a big effect on the parents in interaction with the kid. And the child, in response, does show a big treatment effect. But then when you move into the different context of the child with the ADOS examiner, who's obviously a different person in a different context, different toys, different playroom, etc., then you see no significant treatment effect over and above TAU, and you go out into school, same thing. So this is what we describe as an attenuation of the effect as you move away from the primary focus of the treatment. It's if you like, a transmission gap from our big impacts with the dyad out into the child's everyday life with other people in other contexts. So it's a generalization problem across context, partly. Okay, so what do we make of these results? Well, firstly, as Sally said, this study is one of a number that have come out recently that have been slightly more sobering about the outcomes from these early communication and behavioral interventions. Why should this be? Well, it is a feature of treatment trials and treatment studies in medicine and psychology that as they get bigger and as they get more rigorous, unfortunately, the general pattern is treatment effects tend to reduce. And that's an unfortunate fact of life which has been replicated throughout medicine and psychology in other areas. And it is the case that in autism intervention research, we are just now entering the phase of really reasonably large and rigorously designed treatment studies. I don't want to underplay, though, what this change means. We did show very large effects in dyadic interaction. And these are likely to have very positive consequences, not only for the parental morale, for their feeling about their child, but also, we think in theory, for downstream child development, family environment, parent-child relationships, and possibly child adjustment. And of course, we'll need follow-up studies to be sure about that. But we have shown this difficulty with generalization. And what might this be due to? Well, Sally has mentioned all these points, and I think they're good discussion points for us to think about together. One is measurement sensitivity. As she mentioned, our measures so far are not designed to find sensitive changes in intervention. They were designed as diagnostic instruments, essentially. And although we found good ADOS change in our pilot study, the ADOS didn't do the same thing here. However, note that those of you who know our 2004 pilot study, we actually found the same treatment effect in ADOS in our pilot study, 4-point reduction, The difference in the trial result this time was because the treatment as usual group also reduced, whereas in our pilot it didn't. So the difference between this result and our pilot, at some level, is that the treatment as usual group did better than it did when we did it a few years ago. Well, it's hard to say what that might be due to, but that's an important fact. However, let me emphasize that the way we designed the experiment here within the trial context is that we did show a differential effect in these parental function, this synchrony function, for instance, and other kind of parental behaviors in the dyad. And we did show big treatment effects in that. And so one of the conclusions from this is just by increasing that, doesn't seem as though that's enough in its own to transmit out and generalize into the everyday life of the child. It could be that we're just not measuring it, and we are indeed going back to our endpoint assessment with more sensitive measures to see if that might make a difference. But there remains, and we know, of course, this about children with autism, that generalization of learning is difficult for them. So this transmission gap suggests to us that we need to design adjunctive treatments to help generalization, because we know we can make a difference to the dyadic interaction with these children with this kind of treatment. It might also be a challenge to our theory. It might be other ways and reasons for children with autism developing positively, and that surely is the case. This can't be the only route for development. That's certainly not the case. So what we've been able to do with the particular way we designed this study is to look carefully at mediating processes and at a process analysis of this chain of transmission. And that analysis is ongoing, and it's going to allow us to look in detail at how parental change influenced dyadic child change, which may or may not generalize out into the rest of life for the child. And we hope that this is going to give us useful information to then incrementally design better treatments in the future to move the field onwards. So, in summary, this is a collaborative enterprise that a lot of us are involved in as trialists internationally. It's wonderful to see that there is an increasing critical mass of well-designed and well-powered and larger intervention trials emerging. It's likely the road will be rocky. It's not going to be straightforward to develop good treatments for autism that really do sustain themselves. Some of the early hopes may be dashed slightly, because we know that in all areas of medicine and psychology, early hopes can sometimes be based on poorly designed studies. But let's hope that we can push the field forward and get some really solid treatment gains for our children internationally as we go forward. Here's, if you're interested in more detail of the study, it was published in the Lancet journal this summer, so you can, I think it was in July, so you can look that up. And if you're interested in more detail about the treatment, then go to our website, which is up there, where you get a lot of detail about the actual intervention that we did and the background to the study. Thank you very much.